Loma Linda has been an exciting place to be, and it's never the same year to year. It's been in this sort of accelerated growth ever since I came. To keep up with it all, we really need more.
We have a very clear mission, and we have outstanding faculty. We are proud of our achievements, but we recognize we still have a lot of challenge.
Now, right now, we have an issue because we're sort of seismically challenged. And so we need new structures to be able to keep this striving for excellence going.
We have to make these changes. That's not optional. I think we just have to. We have to keep up with the growth. If we don't keep up with the infrastructure, and certainly healthcare is a good part of the infrastructure, if we don't do that, then I think we're in for a whole lot of problems.
The problem is that if you just kind of coast along taking the path of least resistance, then you're not going to be achieving what you can for the community and the world. So it's an opportunity lost.
Who loses? Our children, our family, our future. We all lose.
It's great to have pretty buildings, but the goal is to make it more accessible to patients, to make it easier for them to navigate, to make it easier for our physicians and nurses to work in an efficient way.
It would be amazing to have, that big, beautiful new children's hospital where, our patients had private rooms and we had all of the equipment that we ever needed to do our job, for patients to be able to get their exams done the same day instead of having to wait.
To educate our students in something other than modern facilities is a disfavor to them. We have to give them something that's relevant.
There are students like myself who know that they're going to accrue debt, and that there's probably going to be times in which you're not sure if you're going to eat because you have to make ends meet. And so going to school and knowing that I don't have it, how could I possibly do this? Over and over, God has proven himself faithful through generous people that I've met in Loma Linda.
Why should we be limited just to what we have? Why not go and fulfill those things that we're called to do? And if you didn't have that level of support, I think a lot of people would just go through and say, there's no way I could ever do mission work.
To think of the unknown and the things that are out there that haven't been discovered, and to think that our hospital would have the opportunity through funding and research to help other families, I can't even imagine.
We lift up people in prayer for loved ones that are ill.
But if we don't address the needs of this community, we are not doing what we are supposed to do. We are not really being an instrument to make a difference in people's lives.